The starting position for the patient is sitting in a chair that has a back. The stabilization comes from the back of the chair. It supports the thoracic and lumbar spine. The stabilization from the therapist is not actually necessary in this measurement. The stationary arm of the goniometer will go perpendicular to the floor, and the axis will be placed at the lobe of the ear. And the movable arm will be placed at the base of the nostrils. The patient will then move through the motion, so Emmy, put your chin to your chest as far as you can. Hold the goniometer in place and move the movable arm back to the base of the nostrils and take that measurement. It's right at about 44. 45 is the full range of motion for neck flexion. Then have the patient move back to the starting position. Everything's the same for neck extension as far as the stationary arm, the movable arm, and the axis. Make sure it's lined up the same, and then have the patient move her head back as far as she can while holding this in place. And then move the movable arm back to the base of the nostrils and take that measurement. She has more than 45 degrees.
Starting position of active range of motion, the patient is sitting. The forearm is resting on the table in either mid position or pronation. And wrist and fingers are in anatomical position. And therapists stabilize the proximal phalanx. And goniometer axis for flexion is placed over dorsal surface of PIP joint being measured like this. An axis for extension is placed over palmar surface for PIP joint like this. And stationary arm is parallel to longitudinal axis of the proximal phalanx. And movable arm is parallel to the longitudinal axis of the middle phalanx. Just like this. To measure active range of motion, tell the patient to move the finger towards anterior direction. This. And for the extension of PIP, tell the patients to extend the finger as much as the person can. Good. Starting position for passive range of motion, the patient is again sitting. The forearm is resting on the table, the wrist is neutral position, and the fingers are relaxed. And stabilization and axis and stationary arm and the movable arm are all same as active range of motion. The therapist grasped middle phalanx to access the PIP joint. And for PIP flexion, the therapist applied slight flexion to and move the middle phalanx in anterior direction to the limit of motion of the axis. And for PIP extension, the therapist applies slight traction to and moves the middle phalanx in posterior direction to the limit of the motion of PIP joint. Like this.
So for your start position, your patient is going to be sitting in a chair with a supported back. Forearms should be resting on the table. The wrist should be in neutral, and the fingers should be in the anatomical position. As a therapist, you will be stabilizing at the metacarpals. The goniometer axis will be placed on the posterior surface of the MCP joint that you are measuring. The stationary arm should be parallel to the longitudinal axis of the shaft of the metacarpal of the joint you're measuring. The movable arm should be placed parallel to the longitudinal axis of the proximal phalanx of the joint that you are measuring. In order to do abduction, you will have the patient move their finger away from the midline as far as they can go. Go ahead and do that now. And then you would take your movable arm and move it back to the middle of the finger. And you're going to be reading here. Then you would go back to midline, ask your patient to go back to midline. In order to do adduction, you will have the patient move the digit to the midline, and then they can also move the rest of the fingers so that the digit is allowed to go as far into adduction as it can. You can go ahead and do that now. And you'll measure. Both of hers are within a normal range. In order to do PRM, you would grasp the patient at the sides of the proximal phalanx and move them as far into adduction or abduction as they can or as pain will allow.